Hi everyone, welcome back to Ward 101 Med. So I'll start by saying this. A general practitioner is not just a GP, and a GP is actually the foundation of healthcare system where we are the ones who see the patients, the first ones to decide what happens next, and we deal with everything from a sore throat to an amputation, and that makes a GP the most versatile doctor in medicine. Now, this is not a theory video, but this is a real case that I recently encountered, and let's begin. So, a man walked into the clinic holding two amputated fingers. So, this has been mentioned in our WhatsApp channel, Case Connect. The images have been posted there. So, he walked into the clinic holding two amputated fingers, the little finger and the one beside it, both cut off by a wood cutter. No hospital, no ER, straight he comes to our clinic, to the GP. So what do you do? As a general practitioner, in that moment, what is your stand? And if any laborer or worker is watching this, what should you do immediately if an accident like this happens? So let's go through this scenario in detail and understand how to manage the amputated fingers or amputated part of a body if ever a patient steps into your clinic. So this patient is conscious, but he's pale and he's understandably scared. He may be slightly hypotensive because of fear and because of pain or because of blood loss. And the first thing is to stay calm, and you have to reassure him as a physician. His panic can increase his blood pressure, or not increase his blood pressure, it can drop his blood pressure furthermore. Now, quickly assess his vitals. Note down his pulse, his blood pressure, his saturation, and if needed, if you think he requires, then you can start IV fluids to stabilize him. Better to give him an NS or an RL. Now, next thing is that you address the bleeding. You apply direct pressure with the sterile gauze to the stump, keeping the hand elevated above the level of the heart. Do not clamp the vessels or try to clamp the vessels or try using a tourniquet unless the bleeding is uncontrollable. Try as much as you can that do not intervene using a tourniquet, and just make the patient keep his hand up, and remember, let them drink some water. We have previously mentioned this in our shot. Now, at the same time, handle the wound carefully. So there's no need for scrubbing or antiseptics or betadine. Just simply rinse the area gently with the saline, and then you cover it with the saline moist gauze. Then wrap it loosely to protect the tissue while keeping it clean. Remember, do not use any betadine. Now the amputated fingers, what do you have to do with that? You don't have to stitch it back. Many patients make this mistake of holding them directly in their hands, and they will bring it to the hospital, which can damage the tissue. So if the patient did not preserve them properly, which actually in most cases won't, it is now your responsibility as a general practitioner to preserve that part of the limb. So take the fingers, rinse them gently with saline, and then wrap them individually in moist sterile gauze, and then place them in the clean plastic bag, and then place that plastic bag inside another bag that has ice and water. Never directly contact the tissues with the ice, because it can cause frostbite like thing. Now, this step is crucial because tissues can remain viable for up to 6 hours. So if kept cool properly and giving it to the surgical team successfully, a chance at re-implantation is possible. Now, the pain management of the patient. Patient comes next, give IV analgesics. You can give them paracetamol, you can give them NSAIDs, or you can give them opioids, whatever as needed. and then you start broad spectrum IV antibiotics such as cefazolin to prevent infection. Make sure tetanus prophylaxis is up to date. Take a proper history of the patient and administer a TT injection if it is required. In the end, remember, before referring the patient to the surgical department, documentation is essential. Record the time of the injury, the mechanism of the injury. In case the woodcutter, in this case, you have to mention how the amputated parts were preserved. Note all the vitals, interventions, and your part of management. Then refer the patient urgently to a hand, plastic, or an orthopedic surgeon, providing the team with all the information they need to make a quick decision about reimplantation. So it's your responsibility to prepare the patient and refer him to the surgical department in order so that the surgeons intervene ASAP without finding out more information about it. So this case shows that every second counts. Handling an amputated part correctly, even before reaching the hospital, can mean a difference between saving a finger and losing it permanently. Most of the patients will not preserve their fingers, especially the fingers. They won't preserve it, they'll bring it in their hands. So it's your responsibility as a GP. Your knowledge, you have to be calm, and quick action can literally save a patient's finger and, of course, their future. Remember this: the primary care is powerful, and preparedness will make all the difference. Thank you.